I'm glad you guys can make it and join me. Since there's not a whole lot of us here, it's kind of an informal, this kind of informal thing. If there's anything you need to ask me in between or whatever, just feel free to just, raise your hand or just say so, and we'll try to do that. Otherwise, we'll do like a Q&A after, I guess. Let me just give you a quick introduction. So you'll establish my credibility here. So my name is Bob Ortego. I'm a seasoned graduate, like where Sadie is graduating from. I graduated from the same program back in before you guys were born. This was in the class of 1985. So I've let's just say I've been around for a while. Let's see. Let me just try to share some screen here. Okay, you guys can see that, right? Yeah, okay. So basically just to give you kind of a summary or kind of an overview of what I'm going to talk about, so you have, if you're going to be interested or not. So I work for LA County Department of Public Health. It's a radiation management office. And my title is basically, I'm a principal radiation protection specialist. And I'm a supervisor for X-ray machine inspections for the entire Los Angeles County. Los Angeles County is one of the biggest county in the United States, actually. And in terms of how many X-rays are out there, Los Angeles County itself, next to probably New York and Dallas and some bigger cities, have the most X-ray machines in one small area. Professional-wise, since I graduated from season in class of 1985, the BSRT program there, my interest when I was a student was special procedures. During that time, MRI was just really emerging. CT was there, but can you imagine a head scan for an hour? That's how long it took then. A chest CT would take like an hour and a half, and a chest and abdomen might take almost 2 hours. That's how fast it's progressed since then. So just to give you an idea. But when my classmates were doing CT and MRI specialties, I was hooked into the dynamic imaging of special procedures. That's why I got into angiography, angioplasty. During my extra time, I would go to special procedures room and learn whatever I can there. And I got interested because I love the dynamic of the images. I mean, I don't mind pushing buttons. That's just not for me. I like to be hands-on, and that's what a special procedures tech is normally does. It's hands-on. So if any of you are interested in doing that, doing special procedures is very specialized, like it says. So that's just another venue for you. So I did that. I was hired as special procedures tech at Computerized Medical Imaging here in Sherman Oaks. And I stayed there for about 9.5 years. I pretty much did everything: CT, MR, diagnostic X-rays. I think the only thing I really didn't do is radiation therapy and ultrasound. But pretty much I tried to do everything. I made that a goal for myself, that I need to learn everything so I can sell myself. And I think it paid off. So I was a staff technologist for like 9.5 years. And after that, I wanted to change. I mean, I love clinical work, but I needed, I'm the type of person that I have to progress every so often, that I need to advance in my field. And that's just my personal goal. And so I learned about this job actually from my wife. My wife, Joji Ortego, she's also a seasoned graduate, class of '86. She graduated year after me. And yes, we're still married for 33 years. And she got into being an X-ray inspector at LA County Department of Public Health a year before I did. When I saw what she was doing, and actually she found a job at a job search in the library. There was a library then. There wasn't anything online. And then she applied for it. And then I saw what she was doing and I was interested. I said, yeah, this is something else. This is like the other side of what I wanted, the other side of what I want to do. Doing clinical is great. You know, you learn all the nuance of clinical imaging and diagnostic imaging. Now you're going to see now you're on the other side where you're actually enforcing rules and regulations in regards to radiation safety. So that really interests me. And the term of being an X-ray inspector, which the first term I heard at first is, I said, that intrigued me. I said, yeah, I want to go out there and be an inspector. And that's basically how I got into it. When I was a technologist at CMI, I periodically we would see these people coming in from the state and doing inspections. And at that point, I really didn't know what they were doing. I know they were inspectors from the state, but all they mentioned most of the time are they're from the health department and they're doing inspections of the X-ray machines. I didn't know there's actually a department that takes care of just X-ray imaging and all the regulations that goes with that. So so that's how I got into it too. After now, my wife's been in the same office as I have for 28 years. I just finished my 27 years. So my wife and I have worked in the same office for the last 27 years, really. And yeah, the dinner conversation is always about, you know how that is. We carpool, everything, so it works out for us. But that's just the way we are. So my wife's a principal radiation protection specialist too, but she's more into radioactive materials. Now, being an inspector, that's another maybe field, I should say. Because in being an inspector or a field inspector for X-rays or radiation management or any other radiation program in other states, there's normally segregation of radioactive materials and X-rays. At least in California, it's like that. There's a section for X-ray compliance and inspection, and there's a section for radioactive materials compliance and inspection. It's two separate worlds. And it has to be like that because there's the regulations, at least in California, they're entirely different. I mean, they're the rules and regulations that each inspector enforce are different. So so currently I'm there. I started as an entry-level radiation protection specialist, or RPS we call them. And then after a few years, I have to move up. I became a senior radiation protection specialist, and eventually I became a principal. And those are the three levels we have in LA County for position: RPS, senior RPS, principal RPS. And after a principal RPS, we're basically be the director of the program. The radiation management program in Los Angeles County, we're a very small program. Currently, we've had people retired or resigned because of the current environment. Now we're down to only 16 people now. That's covering the whole LA County. Now, 16 out of those, 2 out of those 16 are basically administrative assistants. So there's 14, including our director. That makes it 13 just field inspectors. Actually, 2 out of those 13 are what we call plan checkers, and I'll explain to that later on. So the rest of the number is basically the field inspectors, and that's what we are. We're we're X-ray field radiation inspectors. And I guess you could say we're the X-ray police. You know, that's what they used to call us in the early days, because we do. I was going to show you my badge, but we do carry a badge. It's like a cop badge, really. It's a shield. It's a shield badge, and it says deputy health officer, and that's what we are. We're DHOs, deputy health officer. We're and we do the swearing and all that to be be a deputy health officer. So we're DHOs for LA County, but in LA County, radiation management is actually under environmental protection, and then environmental protection is under environmental health, and then that's under the whole county of the county public health department. And the county health department, LA County Health Department, is governed by the county board of supervisors, and there's 5 of them in LA County. So that's the hierarchy of the bosses there. Now, even though I work for the LA County Health Department or LA County Public Health, our program is actually contracted with the state. That means LA County is contracted with the California Department of Public Health Radiologic Health Branch, CDPH-RHB. And in your profession and all through long, you'll probably hear that term RHB or CDPH-RHB or Radiologic Health Branch, because when you renew your license and your certificate or your permit, that's where it all goes. And the main office is in Sacramento, near the capital offices there. So LA County has a contract with them that we'll do, even though I'm a county employee, we're contracted by the state to do state inspections. So every time we go out to the field and inspect these places, these different facilities, we always tell them, yeah, I work for LA County Public Health, but we're enforcing local, state, federal rules and regulations against radiation protection. So basically we're enforcing the whole predominantly state regulations, state radiation safety regulations. So when we go out on inspections, our inspections are based on, some of you might have seen it, or some of you might have seen it on some of the facilities you've rotated through. It's the California Radiation Control Regulations, CRCR, or we just call them CRC, or California Radiation Control Regulations. So that's all under Title 17. And Title 17, there's a section in Title 17 that is reserved for radiation protection, or radiation in general. I won't bore you with what sections they are right now. Eventually, you have to learn them anyway. For those of you who are interested, I'll be glad to tell you where that is, because everything we enforce when we go out there inspection is based on Title 17 or California Radiation Control Regulations. So, because when we go out on our inspections, what we're enforcing are laws and rules and regulations. These are laws, radiation control laws, and so, like any other law, let's say DMV, if your registration is expired, and the cops find that your registration expired, they'll give you a ticket. We're pretty much the same. When we go out there and we find some sort of violation, it's enforceable violation, so we cite the facility, and that means we give them a ticket. We don't call it a ticket, we call it a notice of violation. And a notice of violation is just that, saying that, hey, your registration is, your facility X-ray facility registration expired. You cannot operate your machine until that's valid and current. So we tell them you can't do any X-rays. And that's how much power we have, I guess, as you can say that, because a lot of these facilities, they don't want us in their facility. They dread that we come, but we don't just show up. We could show up, but most of the time we call anyway. So it's just a quick run view of our. If we were fully staffed, this is just a quick rundown of our staff. For our director, we have 2 X-ray machine inspections, actually inspect supervisors, me and Hope Martinez. machines, X-ray machines inspector. There's X-ray machines, mammography inspectors, plant checkers. Now, the plant checkers or radiation shielding is in LA County, and LA County alone, not in the state of California. There's an LA County ordinance saying that anyone who is installing or reinstalling an X-ray machine anywhere in LA County, and that LA County is from Santa Fe all the way to the edge of Thousand Oaks, all the way to Long Beach and north up to wherever, Apple Valley or edge of Palmdale, whatever. So all within that, if anybody's going to install any type of X-ray machine, they have to go through our office because we have to review the room or the area where they're going to install the X-ray machine. We want to make sure there's inherent shielding in there that will protect the patient, the user, and the public mainly for any scatter radiation. And it's unfortunate that LA County is pretty strict about that. The state does enforce it, but they enforce it on radiation therapy units, which is understandable because the radiation therapy units are, high kV units. And if you haven't been into a radiation therapy setting, it's probably another thing you might consider as a profession because it's an interesting field too. But the room where they have these radiation therapy units, the vault, they call them a vault, and the walls are like, I don't know, 6 feet, 8 feet in thickness of pure solid concrete. And that's why most of the radiation therapy places that you know or you're familiar with, they're probably like in an isolated vault area, or it'll be in the basement of a hospital or a medical center, only because the scatter from a radiation therapy unit is immense that there have to be enough shielding in there. So those are the type of shielding that we need to know. If let's say Michelle is going to build is going to have a clinic, and they're going to have a fluoroscopy unit in there, like let's say a C-arm in there. Now we're going to tell Michelle, you need to submit a plan check to us or a radiation shielding application. And what she's submitting to us is a schematic diagram of the room where the X-ray machine is going to be. We want to know what's around the room. We want to know if that's an office on the north side, is that a bathroom on the east side, is that a waiting room on the south side. So all the areas, because those have usage factors. And also we need to know what kind of X-ray X-rays they do, what type of procedures they do. So we take all that into account. Of course, we take into account the exposure factors they use, KVP. You guys are familiar with KVP, MA, exposure time. We take all that into consideration, and that's what a plan check is. And like I said, it's strictly for LA County, so we're very strict about that. So, but for plan check or radiation shielding applications, it's mainly the ones that are for human use. I mean, the X-rays that I can tell you the variety of X-ray machines that we've seen, and some of you probably won't have a chance to see some of them, or will be familiar with some of them. But well, I'll give you kind of a rundown what type of machines those are. Along with our other staff, I mentioned being a radioactive materials inspector. We have 3 of them, not as many. And we actually have 2 emergency response specialists, and that's basically their main job is if there's any kind of emergency event in LA County, we have 2 specialists that will be on point with that. And just to give you kind of an idea, if there's any kind of a radiation event accident of any type, if it happens in LA County, we're the first responders. We are the ones that's going to be on the ground measuring radioactivity on the ground, on the air, and all that. So it's a pretty cool program. And just as a plug, with our 21 full staff right now, where there's only 16 of us, 9 out of those 16 are actually seasoned SRT graduates. And I was telling Michelle and when we met earlier in the week that I'm the person that hires and the person that interviews. I'm one of the person that hires and one of the person that interviews people who come to our program to work. And I'm biased. So that's just a plug. I'm biased because I graduated there. I know the product that I'm getting if I get seasoned graduates. But you know, we have the background on all our inspectors. Most of them are former X-ray techs, and most of them are former CRTs. They did, all of them did clinical. And the reason we want that is it's good to have done clinical work before you get into this kind of profession, because you need to understand what's happening out there clinically. You need to know anatomy, you need to know technique, you need to know all that before you get into this field, because now you'll have a full idea of what's happening out there without questioning why you're enforcing the law, right? Okay, let's see. Now, the compliance program for the state, that's the state of California. I'll just speak for the state of California right now. Just before I forget, in California or in any other states, every state, I should say, have some sort of radiation control program or an agency that controls radioactive materials and X-ray machines in that state, whether it's Nevada, New Mexico, Dallas, New York is huge. Dallas is huge. I think in New England states, they're a combined area that they have. So they have a program that covers the whole area. So if you get interested in this type of profession and you end up in a state, you can, in another state, you can inquire what radiation control agency that oversees this type of inspections, and one inspection, one state inspection is not too different from the other state inspection. The difference mainly is the regulations. Like I was mentioning earlier, California is one of the strictest regulations in terms of radiation safety and radiation control, and other states are not like. Just to give you an example, in California, you have, like what you guys are going to be, you have to have your CRT, your Certified Radiologic Technologist certificate or permit or a licensure. In other states, you don't need one. And that's just the nature of it. Some states are not as strict as other. And in California, you have to have a doctor has, or a licensed has to have a radiography supervisor and operator permit or certificate before they can handle a machine, or they can be a radiologist. So if you happen to work in, let's just say, if you happen to work in a clinic, and let's say you work in the diagnostic imaging clinic, if you work there and you're the only you're the only radiologic technologist there, you can't just, there has to be a doctor in there that's a supervisor and operator permit issued by the state. Those two go together. You cannot have a radiologic technologist without a radiography supervisor and operator. But at the same time, I don't know if you're aware of this. If a licentiate or a doctor gets a supervisor and operator permit, they can do X-rays themselves. But do they? They don't. They just do it because they have to have that, what we call an OFSUP permit, to have to oversee the radiation program in their facility. Excuse me. Now, the state has 4 branch offices throughout the state. That's the main. There's an office in Sacramento, Richmond. There's an office that both the other two offices are in Brea, but they split the areas that covers San Bernardino County and north of that, and then the other office covers like Ventura County and north of that. So that covers the northern area. Now, us as a county, as a contract county office, we cover the Los Angeles area, and there's a San Diego office. So that's pretty much 6 offices in the whole state that enforces radiation control in California. And our office, LA County, is one of the biggest one, only because there's so much X-ray machines in this area. That's why our staff is bigger than the other branches. Now we basically perform routine inspections. We investigate complaints, and complaints could be anything. They feel the X-rays, they feel sick, or and we have to follow up every complaint that we get. Excuse me. We also even radiation overexposures. So there's a lot of I guess the things and the stuff that you learn in school in terms of the physics and radiobiology. You get to kind of apply it to this position, and it gets very interesting that way, because now you're measuring dosages and all that. Before, you were just measuring your techniques and how much mass the patient is going to get. Here you're measuring doses. We also respond to emergencies, like I mentioned earlier, and as I said earlier too, you can generally work in either radioactive materials inspections or X-ray inspections, and I think in some states they're pretty much the same too. Now, with any type of X-ray machines, just like every time I have to talk to somebody on the phone and they ask for registration, I always say, your machine has to be registered just like your car has to be registered with the state. Excuse me. A second. With your vehicle, you have to pay registration every year, right? With X-ray machines in California, you have to pay registration every 2 years. And the prices of the prices that you see right here, right now, they've gone up in the past couple of years, but they're still within that range. So these are the registration fees that the owners of the X-ray machines have to pay every 2 years. If not, if every time we go on in the field and perform the inspections, we look at the registration certificate. If it's expired, you get cited. You said, hey, you're driving without a registration. Same thing. And that's how we explain to them. If your registration expired in your car, you try not to drive it, right? Otherwise you get a ticket. Same thing here. And with X-ray machines, there's different priorities. We have high, medium, and dental, mammography, and mammography. Mammography is basically all the machines that are used for breast imaging. And a lot in LA County itself, most of the mammo machines we have now, most of the mammo machines most of the mammo facility that we inspect have all digital, full field digital mammography units. I think there's just a couple that is struggling, still doing film, but eventually they'll convert to. So, and the dental priority, the mammography, we inspect those every year, only because they're MQSA mandated and also state. So we inspect mammography facilities every year, every 12 months. The dental priority, those are just the X-ray machines you see in dental clinics or in dental labs. Most of us, or probably all of us, have some sort of dental X-ray. And if you notice, dental units are mainly just 1 kVp unit. They're usually like around 65 kVp range, 70 maybe, but usually around 65 kVp. And the only The only variation you have is exposure time, really, because the MA is fixed, the KVP is fixed. Exposure time is just the and there's very little variation in dental exposures anyway, because even though the teeth is one of the hardest, mineral in our body, it's still, and the 65 kVp range is sufficient, but some head geometry are kind of bigger. You don't use the same technique as children as with adults. So, but that's why we don't, with these machines, there's very little chance of it going out of calibration, we say, because there's not a whole lot of chance that it'll do that. The exposure time might go off calibration, maybe depending on how much usage they have on it. But most of the time, it's pretty much stable. Let me look at the time. Okay. Medium machines, medium priority machines are the ones that, let me give an example, veterinarians. If you've taken your dogs, cats, whatever animals you have to a veterinarian, well, most of them have X-ray machines, and most of the time they're a lot nicer X-ray machines than what they use for humans. But they need X-rays too. So those, I think you can categorize medium X-ray machines priority as the ones that are used for non-human use, and these are like the industrial X-ray machines. There's X-ray machines that are used, here in Van Nuys Airport. There's this big X-ray machine that will X-ray the rivets on an airplane, so they can see the welding and the riveting, make sure it's intact and there's no cracks. Those are industrial. They're like high kV, like I think they're like 300 to 500 kVp units, only because they have to go through this hard metal. So medium priority, those are inspected every 4 years or so. Dental machines are every 5, roughly 5, every 6, depending. And then we get to the high priority units. The high priority units are the ones used in the hospitals, the ones that you guys have probably operated on. These are the diagnostic X-ray machines, the C-arms, all the special procedure C-arms, fluoros, radiation therapy units, CT, and of course, MRI is not part of it, because, as you know, MRI is not part of this field at all. So we always get categorized with it, but we always don't have. We have no laws to enforce MRI. So CT is included in there. So with those type of machines, we inspect those every 2.5 to 3 years approximately. So you see the variations in there of what machines we inspect, what our inspectors go out to, and what they have to go out there. There's a lot of dental X-ray machines out in LA County. And of course, a lot of the medical centers and hospitals have X-ray machines, and those are the type of things that we do inspect. And the varieties of machines are very interesting. I mean, we go to the bomb squad, LAPD bomb squad, and they have X-ray machines that they take out in the field, where they take an X-ray package, they put a film on the back, and then they can see the image and what's on the package, if it's volatile or not. And so that's a type of X-ray you don't see every day. And there's a variety of X-rays that I told you that's in Van Nuys Airport. The ones that are in the airport, we if they're not owned by TSA, we inspect them. So there's a lot of interesting places we go. A lot of research and development places of X-ray machines. For example, there's electron microscopes. They don't have an X-ray machine in electron microscopes, but there's an X-ray byproduct that when it's turned on, there's X-rays that come out of this little tube that's on the electron microscope. That's why it falls into our jurisdiction, because we want to know the people that's operating them. So, so basically, we perform these fractions. This is in one of my early days. I think I was still young then. Facility, we inspect the facility's compliance in meeting county, state, federal regulations pertaining to radiation control practices. And that's basically our main goal in anything. It's all about the patient, not about us, not about the facility. It's all about the patient. And it's all about radiation safety. And there's nothing else that we do out there, but just enforce radiation safety, just to make the patients safe. So during inspections, we just make sure that the guidelines and procedures for radiation safety are always being followed by medical personnel. You guys, as technicians, technologists, physicians, to protect the patients themselves from unnecessary radiation exposure during X-ray exams. We want to make sure you're implementing safe radiation practices when you're out there, and that you're employing people that are familiar and understood the safety limits of what the X-ray machine they're using can do. Earlier, I was telling you about we do follow up on complaints, and we do investigations. So we assist the general public with radiation safety questions. We respond to radiation emergency incidents. The complaints that we get in the office range from I'm getting sick in my house. Can you check, see if there's any kind of radiation coming out of the walls? And sure enough, we find that they're close to a cell tower, which is probably making them sick. I don't know, just depends. Some people are just sensitive to that. So, but regardless how ridiculous the complaints are, we have to follow up on it and make sure it's legit or not. And it ranges from all sorts of complaints, and we have to investigate all of them. I think the numbers, the inventory of X-ray machines in LA County have grown from this. I think we're close to like 25,000 now. And that's X-ray tubes. So in our program, the radiation management program, our inspection agency, for an inspector, we have to, as a program itself, we have to inspect 1,740 facilities in 12 months. And so that's about 145 facility inspections per month, which is not a whole lot, really. Individual inspector goal is basically inspect 145 facilities in 12 months. So that's approximately 12 to 13 facility inspections a month. So every week, an inspector would inspect a facility, 2 or 3 facilities a week. That's pretty good work, because the rest of the time there, you do the inspections, you have to do a letter. They have to write the inspection letter and follow up on that inspection all along. So that's the breakdown, just to give you an idea of how we do this. And we do investigations, and of course the mammography facility inspections too, that's counted in there. We talked about how much the registration are on those priority machines, and just to repeat it again, the high priority machines are the ones that are in the hospital, diagnostic imaging centers, medical office, chiropractic office, outpatient pain and surgery centers. Those type of machines are high priority. Medium priority machines are podiatry clinics, the bone thermometer units, industrial use machines, electromyoscopic diffraction male screening units. In LA County here, especially in like Hollywood area, there's a lot of studios there, and most of the studios have male screening units where the older male go through the same machine that you see in the airport to screen their mail. A lot of the courts, judicial courts, have screening units too. Same type of machines that you see in the airport where your luggage goes through. They have the same type of machines too. And those fall under our jurisdiction, so we have to inspect those. And the dental priority machines are the intraoral dental units, the panoramic spinal lift units, and the cephalometric units. And lately, there's an upsurge of a lot of dentists buying the CBVT units, the dental CBVT, which is the cone beam volumetric tomography, but they call it CBCT. So if you hear a CBCT or CBVT, that's what that is. I mention it only because we've seen an upsurge of a lot of dental clinics buying these machines. I think they're getting cheaper too, because with dental CBCT, you can have a nice 360 reconstruction of your teeth, of your jaw, and the dose is there, but not as much dose. Let's just say it's a higher dose than your regular X-rays. Yeah, that's pretty much understandable. We were talking about the certification earlier. Now, in California, the law requires that both physicians and technologists be specifically certified or authorized by the Radiological Health Branch, or RHB, to use X-ray or nuclear material in humans. So technologists or technicians. And if you guys know the difference, you probably do, but I'll explain it to you anyway. Now, if you're a technologist, you're a certified radiologic technologist, then you have a certificate in California as a technologist. Now, there's also what we call limited permittees, LPs, or XTs. Those are X-ray technicians, and that's the difference. CRT or X-ray technicians. You guys are being in the program of having a radiologic technology program. When you graduate, your title is going to be radiologic technologist. X-ray technicians, those are the ones that usually like in a 1-year program, a 2-year program, and their scope of the X-rays that they do is very limited to their permit. Let's just say, for example, I work in a chiropractic clinic and I'm an X-ray technician. My permit says I can only do torsoskeletal and extremities. That's all I can do. I can't do anything else. All I can do is C-spine, T-spine, L-spine, hands, feet. That's it. If you violate that permit, you're driving without a license. If you do abdomen, KUB, you do skull, and you only have torsoskeletal and extremities, you're driving without a license. So those are citable offense. So, and a lot of the violations or citations that we do out there are mainly operators. Secretaries are doing X-rays. The doctors show them how to do it. Now they're doing it. They think they know it. Of course, it's a matter of positioning there, turning on the light, take a picture, right? That's as much they know. They don't know the background, the geometry, and how much exposure the patient is getting. No idea. They're just pushing the button. So those are the ones we're trying to prevent, and there's plenty out there. And those are the type of things we're enforced. We're trying to get these, shady places that are hiring non-certified people to take X-rays. So just to be out there, just make sure whoever's doing your X-rays that you can see their permits or their certificates. Licentiates, I mentioned earlier, licentiates are physicians, chiropractors, podiatrists, all types of doctors. So they must be certified to take X-rays or supervise a technology technician. And same thing, nuclear medicine physicians must be approved on the license. So with licentiates, just like you guys, technologists, after you finish the program, you take your exams to get your certificate or your permit or your license. Same thing with the doctors. They have to do, they have to pass an exam, and the exam is actually more of a radiation safety examination. Most of it is about radiation safety. There's some geometry, a lot of Bouchon stuff, if you know Bouchon book stuff. So a lot of the material is from that. So they have to take an exam too. If they don't pass that, they don't get the permit. They don't get to supervise or operate the X-ray machine. Now, when we cite facilities, the violations of radiation control regulations are misdemeanors. They're very extremely rare to prosecute. Now, the law and regulations give radiation control staff the power to enter all reasonable times in any property within jurisdiction of the agency. Basically, what this is saying is we can inspect any facility that has an X-ray machine anytime. We don't have to call you. We can just show up there. But as a courtesy, we call ahead of time, a week ahead of time, or 2 weeks sometimes if it's a big facility, saying that, hey, we're coming in at this date and at this day and at this time, and we're going to do a radiation safety inspection on your X-ray machines and on your radiation program. That's in brief. That's how we explain ourselves when we have to call that we're performing the state inspection, and that's at that point that they lose sleep, because now the state inspector is coming, and it's a big deal, and it's probably good that it's a big deal, because we want them to be serious about the radiation program and the radiation safety program. So and most of the places that we go to, especially big medical centers and hospitals, they have a great radiation program, radiation safety program that QA and QC is laid on the books, and they implement all the rules and regulations regarding radiation safety that the California laws are enforcing. So sometimes we go to a medical center or hospital, we don't see any violations at all. The type of things that we check is the Kvp accuracy. You guys are familiar with kilovoltage peak accuracy, plus 10% of indicated on control panel. If you put 80 Kvp in there, and we carry a lot of radiation meters, and we measure 90 Kvp, that means your patient is getting too much dose, right? Because your Kvp that you put 80 Kvp on your dial, but it's actually not giving you a higher. So those are the type of things we look at. HVL is not an issue right now. Most of the machines out there have, but we still check half-value layer anywhere. Exposure time, accuracy, and reproducibility. We want to make sure that when you're putting 0.2 seconds in there, that you're getting 0.2 seconds, not 1 second. Reproducibility is basically, if I shoot 3 exposures at 80 Kvp at 50 mass, I should get the same exposure 3 times at that technique. That's what reproducibility is. It shouldn't vary from one exposure to the other. So we check that reproducibility, output reproducibility. Collimating device, it's that collimator that you go on the top there and you see the scale. If you put 10 by 12 or 12 by 14, whatever the size you're getting on the collimator there, what you see down here should be that size. Well, what you're seeing is the light sometimes, but that light doesn't mean anything. That light you see on the table is sometimes doesn't coincide with what you see up here on the collimating device. That triangle might be kind of wider on the bottom, only because the blades on the collimator is not adjusted, it's out of whack. So we want to make sure that collimating device is within limits. And we do scatter measurements too. We used to do some entrance skin exposures for different kinds of exams, but not anymore, but we do sampling still. So in addition to all these machine inspections and along with the personnel inspections that we do, we look at the overall radiation safety program of the facility. The radiation safety program can range from, they can have it on some sort of, it's instructions on the wall saying, when you take x-rays, only these people are allowed in the room. That type of instructions. And of course, we need to see their certificates are posted, and if there's any kind of patient pregnancy protocols that you follow, those type of things. Now, let me just pull up an item here. I always say phone badges, but your personal dosimeter, whether it's Landauer or whatever you wear in your facility, by law, let's say you go out there on a facility, by law, you have to wear a personal dosimetry if you're working around radiation therapy or fluoroscopy or high energy units. Now, if you're in the hospital, if the hospital mandates that you wear personal dosimetry, then you have to wear it whether what type of X-ray machines you're using, doesn't matter. But out there, let's say you're working in a dental setting, they don't have to wear personal dosimetry. Along with state regulations, there's federal regulations that we have to follow regarding radiation control. And in that federal regulation, it says that you have to wear personal dosimetry if you're meeting 10% of the occupational dose limit. And you guys should know what that is. I'm not going to tell you what that is. So that's when we can enforce. Yeah, so in the setting, in radiation therapy settings and fluoroscopy settings, a lot of most of will meet that 10%. That's why we enforce them that they have to have personal dosimetry. But in other settings where there's low energy units, they don't have to wear one. But that's sometimes debatable. Personal qualifications, we'll look at that. And we talked about X-ray unit registration earlier. Film processor, they're still archaic and they're still using film. A lot of machines right now are in digital, which is nice. The problem with digital that we're running into right now is nobody knows how to use, or what do you call the ranges? I can't remember. The film range, not film ranges, but there's ranges on the digital unit that they have to follow in terms of how dark or how bright, how light it should be. And very few users understand what that is. Darkroom, they're still using darkroom. We want to make sure it is dark. It's an efficient darkroom. Film stream, they're using film stream. Image quality, we check their image quality. We tell them, can you pull some chest x-rays? Give me some extremities and lumbar spines, and we look at the film quality. Since most of our inspectors are former x-ray techs or former radiologic technologists, we know what a good film is. We know, and that's when all the things come back to your head when you were a student. You're talking about detail, you're talking about contrast, you're talking about all, latent image and all that. So we know what a good film looks like. We know what a diagnostic film looks like only because of our clinical background. And that's where the clinical background helps, because we understand what that is. We know what an overexposed film looks like. We know what an underexposed image looks like. So, and so if we see that image quality is poor, then we have to tell them. Make sure they have all the protective lead clothing and personal monitoring badge we mentioned earlier. And in California, they require, what time is it? Okay. There's posting requirements. And I was telling you earlier about Title 17, California Radiation Control Regulations. It's the current one. Make sure they have a current copy of it. Also, caution X-ray sign. If you happen to run into a caution X-ray sign issue in your facility where you're going to be working, state regulations say you just have, let's say you have an X-ray machine in one room here. You just have to say, you have to have a caution X-ray on the other side of the door, or on wherever there's people walking, they have to tell them there's an X-ray machine in that room. Now, it doesn't have to be this caution X-ray sign with a radiation sign in it. All it has to say is caution X-ray. You can just type caution X-ray. It could be big, could be small. In the regulations, it doesn't say how big it is. So you can have a caution X-ray typed in a card. You put it down outside. But most of the time, a lot of facilities like hospitals, they like to have this, like the example you see on the slide there, a caution X-ray. And you do have to tell that. Now, you also have to have some notice to employees poster that you can get from the RHB website on the state. exposure technique chart, you have to have one. Radiation safety instructions, operating procedures. The operating procedures are mainly the user's manual. We want to make sure that they have it. Radiation safety instructions are, things that I think I mentioned earlier, who's allowed to be there when X-rays are being taken, and who's allowed to hold. Are you using gloves? If you're doing pediatric patients, are you using all the safety precautions? All those type of things. So we're, like I said earlier, we're looking at the whole radiation safety program of that facility. We inspect all X-ray units for you and medical and medical diagnostic use, including mammo units. Inspect CT units, body and oral dental. PET CT units, radiation therapy units, linear accelerators. Just to mention, radiation therapy units. With this type of units, when we inspect these facilities with therapy units, a lot of it is QA/QC material. We don't have the means to really inspect the machine itself, but we do a lot of scatter measurements around the vault or the room of a therapy unit, make sure that the shielding or the vault is intact. There's no scatter when it's on an operation, that there's no scatter radiation coming out of all areas of the room. So a lot of that is basically bookkeeping. There's a lot of bookkeeping on radiation therapy. So we do. So we visit medical clinics, chiropractic clinics, blood clinics, dental clinics. So we go through all types of clinics. Let's just say if you have an X-ray machine, we oversee it. If you have an X-ray machine in LA County, our office oversee it. Whether you're a clinic, you're in an industrial place, X-ray microprocessor boards, or a lot of industrial places. Like there's an area in Van Nuys that they and some in Chatsworth, some in the northern part of the valley too. There's manufacturers in there of computer boards, and they put these computer boards in a small X-ray machine, almost looks like a microwave, and they X-ray that computer board to see if the welding is intact and all the weldings that they needed that they performed is intact. So those type of machines. And there's another example. There's a manufacturer of vehicle wheels, alloy wheels. These are the ones you have in the car. When they polish and then when they weld those, they have this industrial size unit for a fluoroscopy machine. So it goes on a conveyor, and then they see the welding in there, make sure the welding is intact on these alloy wheels. So those type of example. And these are the interesting machines that you don't usually see until you go out there and inspect them. There's what we call diffraction units that are used for research and development, electron microscopes and all that. So all types of machines. It's very interesting. I think that's the most interesting part about this profession, is we see all kinds of machines. And the problem too is we can't keep up with technology, because it's going too fast for us to enforce this old rules and regulations that's not even apply. For example, just on the CT units itself, because of that incident that happened, I guess we all know about in Cedars, regarding that ring and that ring exposure, and it has a ring halo on the patient's head on the CT units. That was our office had to inspect that because it was under our jurisdiction. So we from that investigation and follow-up we did on that, they were able to push CT regulations that are enforceable now. So, but rules and regulations and radiation control laws, most of what you see now are pretty old. They're outdated. They're trying to change that now, and hopefully it'll be up to the current standards of how machines are, because during that time there wasn't any digital X-ray machines when these laws were done. So there is no mention of digital X-ray units or digital X-ray machines in the state regulations. It doesn't. Oh, exposure index. That's what I was trying to get. There's no mention about exposure index in there. So hopefully it'll get updated as the technology comes up. But hopefully it'll get there. And unfortunately, we're not there yet. Again, industrial use, mail screening, contraband screening units, airports. I think I mentioned that earlier. That looks like a machine from, I don't know what that is. I think that's a diffraction unit from, I can't remember, some university. So the positive, we're close to the end, so hang in there. I think I can make it there. Now there's positive outcomes to this inspection. The positive outcome is it's reduced exposures to workers and the public. That's our main thing. That's our main mantra. Reduce potential for the accumulation of radioactive materials for terrorist activities, improve image quality in the medical diagnostic setting, reduce potential for harm to future generations and the environment from a controlled recycling, use, or disposal, perception by the public that the government is doing something to protect their health and safety. You know, somebody has to look after them, right? And like I said, it's if you get into this profession, it's a very interesting profession. Now, nobody gets into this profession straight from college or straight from bachelor's program or associate's program. There's no school for it. There's no school for being an X-ray inspector. It's all OJT, on the job training. That's why when, let's say which what we're doing right now, we're hiring right now, actually. We need to hire like 5 people in the next 2 years. But the people that we hire, the standards that have gone up for our requirements, we're actually requiring a bachelor's background now, which we didn't used to. So those are the type of background things that has ramped up, because before we didn't have to ask for that. And of course, we prefer somebody who has done clinical work, let's say for at least 5 years. If you've done less than 5 years, it just depends what type of clinical work you've done, and then we'll consider you, and then you have a bachelor's program and all that. Now, a lot of the states outside of California, they might not be quite as strict. If you're working for LA County, that's the requirement. If you work for outside of LA County, but still with the radiological branch with CDPH, some of the inspectors, from what I understand, they're not even technologists. They just have a science biology background. They didn't even do clinical. But there's very few of that, only because they either have a master's degree or any type of higher education. But most of the X-ray inspectors in California in general, I should say 70–80% are former technologists, and it helps that you are a former technologist before you get into this profession. That's our radiation response team truck. Just in case there's an emergency, we do have a truck, so we're proud of that truck. Let's see. I'm trying to see what I didn't mention. That's my team. I'm right there. We had Hawaiian Day, so see, it's predominantly women. Interesting. And I actually, and I don't know what that is, but it just is. More women than men, even now. Now, trying to think if I've missed anything. Just as a closer, Again, I'll just repeat it. If you're interested in this kind of profession, it's out there. It's just keep it in the back of your head. If you're tired of clinical work after 5 years or 10 years, you've put enough time in there and you want to do something else. Although some of us are happy doing clinical work, there's nothing wrong with that. It's an honest profession. It's a great profession, being a CRT. I have nothing against it. I still am if I want to. But keep it in the back of your head. Maybe you want to be an X-ray inspector. If you happen to land in some other state, not in California, find out who the radiation control program is in that state and see what the requirements is, and maybe you can do it straight off college or straight off from your associate's degree program or whatever, and see what the requirements is. The requirements are different from state to state, but it never hurts to inquire, because it might be something that you'll be eligible to apply in after several years. Now, like I mentioned earlier too, there's no school for this. At least in California, there's no school for this. There might be in other states. But let's say I hire you and we get you in as an entry-level radiation protection specialist, then we're going to train you doing dental X-ray machines first, and then diagnostic X-ray machines, then fluoro, and then it becomes complicated with that, and then CT, and then radiation therapy. So it's a step-by-step thing, all on the job training, until you understand the rules and regulations concerning the enforcement of radiation safety in each of those modalities. And we won't move you until you understand what those are. So the Title 17 California Radiation Control Regulations is our Bible. I mean, I don't know it by heart, but I know it enough that I can quote you sections of the regulations. Since I've been doing this for the last 27 years, I can quote you sections of what laws you're not following. Let's see. I think I'm at the end of it. This is the, if any of you have any questions about this, or if you want any contacts of any radiation control agencies in other states, I have a list of those, since I belong to a group of radiation control enforcement agencies all across the United States. So I know who are the contacts on those. You have my email. I have 2 emails, one's the state, one's the county. And if you want to visit the RHB website, you can Google just RHB, CDPH RHB California. It'll take you to the Regional Cal branch. And just to give you an idea, that's the main web page for website for CDPH Regional Cal branch. And you can find, some of you might have actually visited already. You can find all your resources there for applications. And resources for references are there in terms of radiation control are there too. I believe that is the end. Let's see, did I make it? Yeah, a little over an hour. Oh, thank goodness. I see, as you can see, I can babble on. I can still go on forever if you guys. So if you have any questions, we can spare a few minutes if it's okay with Michelle and Sadie and Samantha. We could do that. Or if you want to type it on chat, that's fine too. I'll try to answer it the best I can. It doesn't have to be regarding this profession. It could be anything about X-rays. I mean, I've seen enough of it that I can probably answer most of it. And that concludes that talk. So if you guys have any questions, please feel free. You can just talk or chat or whatever.
Yeah, thank you so much, Bob. That was super informative. There doesn't appear to be any questions in the chat, but if anybody wants to type or ask any, we'll open the floor right now for a few minutes.
Sure. Don't be shy.
I wrote down a couple. Just, I don't know too much about radiation, and I'm more sonography for sound waves versus X-rays, but it's very, very interesting. And so you were talking about the 3 per week, like 3 inspections per week. So do you go out as like an individual that's working by yourself, just very autonomous, or do you work as a team to go out on site and do those together?
That's a good question. Let's say we're doing LA County USC down here, and LA County USC has, in that hospital alone, has 265 X-ray machines. We could be there the whole month. So we try to do a team inspection on that one, so one person is not inundated and will be there for a month just doing inspections. I'll just get tired. So, but a lot of what we say our bread and butter are what we call doc in the box. Those are the ones you see in the corner, the medical clinics, the chiropractors that's in the corner, and that they have one X-ray machine. They don't have an X-ray tech. They just have the doctor doing all the X-rays, and it only takes one person. So it just depends on the facility that we're inspecting. If there's a lot of X-ray machines in there that we have to go through, then we do a team inspection. Otherwise, most of the time, a lot of inspectors, we always tell them you have to be independent, because and that independency includes learning the regulations when you're out there, because they're going to drill you. I mean, the doctor's going to drill you, the CEO is going to drill you, the lead technologist is going to drill you about regulations. So we try to push that independence. And of course, they get stuck, they call me, but otherwise we tell them, you're out there, you're on your own. So it just depends. And with sonography, Michelle, if you're getting to that field, unfortunately in California, there's no regulations in sonography too. I think there's like it depends on the facility you will be working, then they enforce their own policy based on the practice, the general practice. Same thing with MRI. There is no agency that is enforcing MRI at all. It's all what's out there, what's the norm. And there's an MRI society, but they're not a governing body. They do push policies and suggestions, but no, yeah, that's just to give you kind of background on those.
Thank you. That's really interesting that there's
Sure.
nothing for sonography. I mean, I know that we've worked with phantoms and talked about, calibrations and things like that. We're always working with a LARA principle and things like
Yeah.
that. But yeah, there's nobody that comes in from the state side to enforce any of those things. So that's interesting.
Right. So in your profession, if once you go past this training and school and everything, you'll see one of us in one of us being one of the state inspectors. You'll be able, and if you see them, ask them. Most or at least all of us are very nice. We're there not to scare you or for you to lose sleep before an inspection. My thing is, I'm very friendly to anybody who I inspect, because I want them to be comfortable with us, or any of us, when the next time we're there. And it's a teaching moment too. I can tell them the regulations that they don't understand. So the next time I inspect them, I don't have to deal with that anymore. So there's a learning that goes with that too, and a teaching, which is good too.
I had a couple other ones along with the violations you were talking about. You said that do you give them a matter of weeks or months to become up to code prior to any like financial payment, or are they automatically given some sort of financial?
Excellent question. Let's say their KVP was off by 20%. So we give them a notice of violation. The notice of violation is like that ticket we were mentioning earlier. The notice of violation gives the facility 30 days to correct that violation. So they have 30 days so we tell them, okay, get your X-ray service company to come in here and calibrate that KVP. If it's 80 KVP, we want to see it close to 80 KVP. You can't always get to 80 KVP. It might be 80.5, 81, 80.9. It's close enough. but not 15% or 20% or 50%. My God. So we do give them 30 days. Most of the violations that we cite, we give them 30 days to correct it, but they can still use the machine within those 30 days. Now, if they don't correct that after 30 days, we give them another 15 days to correct it, right? Because now we're saying, okay, 30 days that we haven't seen a response, they're not listening. We give them another 15-day letter. Now it's after that 30-day, now it's gotten 45 days. After that 50 days is done, they're still not giving us the corrective action. Now it goes into what we call escalated enforcement, where we actually have to refer them to legal department in RHB, which is very rare. Once it gets to that, then we have to issue a C&D, a cease and desist, where we're actually telling the facility, you cannot use this X-ray machine until you correct the violations. And at that, it normally doesn't get. We just had an earthquake. Sorry. It's still going.
Oh, wow. You okay?
Okay. Yeah. Okay. Cool. Where was I? Oh, the violations. So they do have 30 days to correct the violations. And if they don't, yeah, we tell that we can shut them down. And at that point, they don't want to be shut down. They'll correct the violations right away. Yeah.
And you said that's, sorry, Bob.
Sure.
So you said that that's only if it's just slightly over, like say the 80, like 80 point something. But if it was a large increase, then they'd have to stop using it immediately, right?
Right. Yeah. Let's say that
If it's
80
15%, it would
yeah.
double the output, right? So
Right. Yeah.
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 so bad. No bueno, Bob.
Yeah, we know all that. We know what that does, especially if their exposure time is off. That sometimes we worry about that. So any of those, and it's all about wear and tear on the machine. You know, technologists use them, and old machines, new machines, if you use it so much, the controls just go off whack, and it's just the nature of the beast. The machine just goes off calibration. Fortunately, some medical centers, some big hospitals, they have regular maintenance, like once a month or once a year. But with little places like chiropractic places or dental places, they don't have that because it's going to cost them money, so they don't do that. And it's not required for these places to have these machines calibrated. It's not in the law that says your X-ray machine has to be calibrated every year. Nothing. Most of them just wait for us to come, and then we tell them, hey, your KVP is off. You got to have it fixed. So then they have 30 days to fix it. It's that type of a scenario.
I see. Thank you.
Sure. Anything else? Anybody else? Don't be shy.
Is there anyone else? I had one more if folks don't mind. I know you mentioned 5G, or, you know, these cell towers. Has
Right.
that now been a big thing coming up now with the whole launch of 5G and all these different companies getting on board? Is that going to be any implication, or?
No, I'll just answer that based on what I have read, because let me start with this. We're called Radiation Management Office, but we don't regulate every type of radiation. But it also is a source for the public to complain about any type of radiation. And when they see when they type radiation or search, our office comes up, and then we have to answer them about cell towers and high voltage towers. And we have to, and we tell them we don't have any type of meters to measure cellular wave or high voltage tower waves or any of those outside from the ionizing radiation or non-ionizing radiation range. So we try to just refer them and try to help them, although from just the literature I've read, since 5G has gotten implemented, we've gotten more complaints for some reason in terms of people getting sick or people just feeling something. I don't know what it is. It's just like the timing, but we notice some of the complaints that we get regarding that, and we do have to follow it up. Like I said earlier, they're close to the cell towers, and some people are just super sensitive about that. And I'm not an expert. I'm just basing it on the investigations that we've done, and there is some truth in high voltage towers. They do emit, some radio waves and some harmful waves if you're close enough. But then if you notice, high voltage towers like the ones you see in the big towers and all that, they are spaced for a reason like that. They don't have houses next to it, although they might be houses like 50 feet or 100 feet back out there. But there's a reason it's 100 feet back there, because it's been measured. There's a reason for all that. But then, we just noticed that we've had an upsurge of calls about cellular towers, and we still have to follow them up regardless. And we ended up just referring them to Verizon or AT&T or whoever the carrier is. So you got to call them. That's who you do complain to. We have no means of measuring that.
Yeah, I guess those companies need to take those on themselves.
They do. Anybody else? I know you guys are getting tired. It must be a long day.
And the one last thing was what you said that you guys are moving technology is moving faster than you guys can keep up with. So at a certain point, will they then force everyone to go digital, or will they retire, the old school way at some point? Are you guys still?
It seems to be going that way without any of our input at all. It's just the progression of technology, and all we can do is just kind of follow along and apply whatever regulations that's in existence to still maintain that radiation safety environment that we're trying to push and enforce. To give you an example, we were talking about CBVTs and CBCTs earlier, that a lot of dentists are buying it. Now, it's not under regulation. You don't see CBCT or CBVTs under regulations, just cone beam volumetric tomographies they use in dental facilities. It's not under regulation, only because the regulations that these were written 30 years ago, 40 years ago, were all based on screen film. So, and that's the only drawback of our current regulations, at least in California, is the change on radiation control laws is very slow. It's very slow. We can't keep up with new technology and how to enforce the regulatory rules against those type of machines, because they don't apply. All we can do is, okay, we'll give them items of concern, we call it.
And just entry level kind of ballpark salary ranges for this kind of profession?
It's good pay, actually. Well, let's put it this way. When I was first hired, I was doing MRI and CT and special procedures at that time, so I was on the top tier. Because even nowadays, I think MRI technologists do earn quite a bit. It's a good profession. When I knew about this job, the pay then wasn't as good. So, but my former environment where I worked was getting toxic. So I had to leave. So I didn't care about the money. I just had to leave. And 27 years after, I'm still here. And now I'm on the top tier. So if on entry level RPS, I think in California, at least, it's about, don't quote me on this, I'm basing this on like 3 or 4 years ago. Let's just say it's around $35 an hour. It's pretty good pay. Upper level principal, close to about $50-$60 an hour, just to give you a ballpark. It's good, and In some states, like New York, I heard they pay their inspectors well there, only because it comes with the territory and the job that they do there. So it's a good profession, at least. At least for me for the past 27 years, and Joji, my wife, for the past 28 years. So we seem to like it. We stayed. The attrition rate is very low in our office. People leave because they have bad backs, they're getting retired, or they're moving somewhere. It's never a dull moment because it's a different thing, a different place every time you go.
Thank you.
Sure. Anybody else about anything? Otherwise, thank you for inviting me, Michelle, Samantha, Sadie. Thank you for inviting me here, and I wish I shed some sort of light of what life is on the other side, per se, other side of clinical. That is, there is life after clinical. Of course, other than clinical, there's other things too. There's applications. You can work for Siemens, you can work for GE as an applications tech. They love hiring technologists because they know how to use them. Applications tech, sales, you can do sales, that's awesome too. Of course, with application and sales comes traveling. If you want to travel, hey, more power to you. I love to travel, but not being in a different hotel every month or every other month. With family, that's hard. So it just depends on your lifestyle and your social life and all that. So, but this is just one venue that you can think of, but there's other venues there. But in the back of your head, think about it. It's an awesome job, I think.
Well, thank you, Bob, for volunteering to speak with us today. It was a great presentation. We really do appreciate you.
Sure. Yeah, if you want to invite me some other time, I'll be happy to. I can talk about it. I can babble about it. I mean, I streamline everything in 1 hour, but I could probably talk for like 3 hours, but that's enough. I'm going to bore you guys. But thank you again. And thank you guys. Thank you, Sadie, Jagit, Angela, Taylor, Gina, Michael, Diana, Renee, Michelle, and Julie. Thank you. And good night, I suppose.
Yeah, well, I think, thank you. You're